With the recent approval of the first ever pill for postpartum depression, today we're focusing on maternal mental health, which affects many women either before or after delivery. And joining us to talk about this and what we can do about it during September's National Suicide Prevention Month is Dr. Gary Grosel, an OBGYN and Chief Medical Officer for UnitedHealthcare of Ohio. So, Dr. Grosel, can you help us better understand how pregnancy and childbirth can affect a woman's mental health?
Yeah, thanks for having me. And while pregnancy and childbirth can be a time of joy, it's important to recognize that that's not the case for everyone. And in fact, it can become a vicious cycle for a woman who struggles with the thoughts that she should be happy. 1 in 5 experience pregnancy-related mental health conditions, and 20% of these women will have suicidal thoughts or even attempt self-harm.
So what are some of the warning signs of maternal mental health issues that we should look out for?
Yeah, and mental health conditions are among the most common complications in pregnancy and can present in many different ways. Some women feel unable or unwilling to take care of themselves, while others actually have a negative thoughts or an attitude towards their child. In some cases, women may even experience hallucinations, psychosis, or severe depression. I had a patient who came to me postpartum wise, and I knew something wasn't right. I had taken care of her for 9 months, and what I decided to do at that point was bring her over to the ER, and she actually had postpartum psychosis. I talked to her 3 months later. She doesn't remember anything that went on that day. So you have to understand that it requires a comprehensive approach and understanding of this.
So are some people more likely to experience these severe mental health issues around pregnancy?
Yes, those with a history of anxiety or mood disorders, or where there's a family history of postpartum depression, and also women with poor social support systems who abuse drugs or alcohol, have an unwanted pregnancy, or even went through a difficult birth will be at higher risk. The sad part is that there are certain races or cultures that see reaching out for help as a weakness, and the women will feel judged. And so that becomes a difficult thing for them.
We mentioned the new treatment option that's now available to help treat postpartum depression. What are some things to consider if you're exploring these kinds of treatments?
Yeah, and you may only need to talk with your provider about your feelings, and that could be all that is needed. But your doctor will, and between you and your doctor, you'll understand if something like a medication is needed. There is right now a postpartum depression medicine called Zurzuvae, and that medicine, compared to other antidepressants, takes effect right away. Within 3 days, it's working. And then you only have to take it for 14 days, and it will last for that entire postpartum six-week period. Realize there are some side effects associated with it: drowsiness, dizziness, and also that the Scalia study that was done with that medication did not show that you can take it during breastfeeding. But there are more studies that are going to be done to see if that is a possibility.
What are some other strategies that women can consider to support their mental health during and after pregnancy?
Yeah, be educated about the changes that occur during pregnancy, especially the great decrease in hormones that happens after delivery. And understand that providers are there to help you and figure out exactly what is needed physically and mentally for you. And then know about your health plan. At UnitedHealthcare, we have EAP, which is a employee assistance program. And that program actually has behavioral health providers that confidentially reach out to you and are able to talk you through what is going on in your life.
So I know you mentioned there, what other programs or resources are available that can help?
Yeah, and at UHC.com, it's always advantageous to take a look at that and see what is available. There are many coaching, behavioral health options, virtual options, and the EAP, as I suggested.